Surgery is always painful. Surgery is always significantly painful. That's the bad news. The good news is we have great ways of treating that now.
The knee replacements between knee, shoulder, and hip, knees classically have been the more painful surgeries to go through. With knee and hip replacements, there's saws that we use, there's different things that we do to cut the arthritis out of the bone. We're either cementing in or press fitting on parts. We do a lot of things that cause inflammation. Inflammation causes pain, and these are things that, again, initially you're gonna hurt. But we have a lot of things that we do to try to help mitigate that pain. And again, as time has progressed, we have more and more techniques that we're doing that are really helping people get through surgery without the level of pain that they used to experience in the past.
Every patient that is in discomfort after surgery, we wholeheartedly believe and accept. Whether it's a little or a lot, it's their pain, and they're living it, and we need to try to do things to minimize that.
In the past, there's been a very big reliance on narcotics, and we've all heard about, opiate issues. So what we do here is we offer what's called a multi-modal approach to pain control. So from the moment that a patient hits the door, the day of surgery, to the time they leave, we're giving them a host of different medications and pain treatments that hopefully prevent their dependence or their use of narcotics entirely. I've actually had quite a number of patients that have gone through hip replacement and they never took a narcotic pill. Not as common with knees, but I even have had some people with redo knee replacements that never took narcotics. Because we're doing a pretty good job of modulating their pain and controlling their pain well enough in the hospital without it, that when they leave, they're pretty successful. But it always hurts.
We try to help people strengthen their mental fortitude. If they can have a good support system or call in their favors, as I say, to have some people help them, to support them, try to minimize the other stressors in their life and put those on the back burner. Whatever experiences they've had in life that helps them, overcome, they should rely on and realize that they will overcome their surgical pain, and it gets better and better each day. And as they make gains in motion and strength and function, and get off their walker and start driving their car and going for walks, and going to movies, they then take those as great encouragement that you're getting better and that there's light at the end of the tunnel.
I think it's worth it when you get to a point where your function has deteriorated so much that you no longer engage in the things that you enjoy doing. And when you're almost housebound because your arthritis has crippled you that much, I think it's well worth looking at and exploring the options for joint replacement surgery, because it absolutely can restore function.